Nicole Worth from Possibilities for Change. Welcome to our webinar, Adolescent-Focused Motivational Interviewing, an Interactive and Educational Introduction to More Effective Youth Communication. Your webinar presenter today is Dr. Jennifer Salerno.
Hi everyone, my name is Sierra Brooks and I'm from School-Based Health Alliance, and I'm so happy to be partnered with Possibilities for Change to do this webinar today. And at School-Based Health Alliance, we believe that all children and adolescents deserve to thrive. We connect our sector to national community of peers. We support our field with common standards, measures, data, and research to effectively demonstrate their value. We provide the field with high quality resources, training, and motivation and inspiration to excel in their work. When health and education come together, as we all know, great things happen. The Alliance works to improve the health status of children and youth. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools and timely publications, networking opportunities, and more. And we ask that you visit our website for more information. And we are also very excited to announce that our convention is almost here and registration is now open. Our convention will take place in the Washington, D.C. area on June 23rd through the 26th. So register now for the early bird rate, and our members receive a special rate. And the Alliance is truly excited to continue this work with Possibilities for Change at our pre-conference that Jennifer will talk more about later. We also have our Be the Change youth program, and scholarships are available to help students attend the convention, covering the cost of hotel and duration of the program. So we ask that you please join us. And again, thank you, Jennifer.
Before Dr. Salerno begins, I have a few housekeeping items. Please view the presentation in full screen mode. Some fonts or images may appear small, and full screen allows you to see everything we're sharing during the webinar. Participate in activities and ask questions throughout the webinar by using the chat and questions box. Click the arrow to open the box on your GoToWebinar panel. We have included some handouts for your review after the webinar, including the PowerPoint slides. If you would like to have access to the slides, please be sure to download them from the handout panel. We will not be sending them out afterwards. Click the arrow to open the handouts box, and then click on the icon to open the document. Lastly, at the end of the webinar, you will have the opportunity to raise your hand to ask questions. I will unmute you at that time so that you can verbally ask any additional questions you may have. Please click the hand icon on your GoToWebinar panel if you have any questions you would like to ask. And now I will hand it over to Dr. Salerno.
Great. Thank you, Nicole and Tiara. Before we get started, I'd like to get an idea of your experience with motivational interviewing. So did you come today thinking, I've heard the buzzword MI and I want to know what people are talking about. I want to figure out, what it's all about and how I could use it. That might be A, if you've attended a training or two, you have an idea of motivational interviewing, you would pick B. And then if you use it routinely, you're attending this webinar because it's always good to hear it again and get some other little tidbits of information about the strategies that you might implement, then you would click C. So we're going to open a poll, and I'll give you a few seconds to kind of choose A, B, or C. So it looks like we have about 80% of you voting. I'll give it another maybe 2 or 3 seconds. And then if you could share the results. Great. So thank you for sharing that information with me. It looks like about half of you have attended a training or two before. About 30%, this is new for you, so I'm excited to share some of the information. And another 20% of you use it routinely. So this is going to be an interactive webinar with polls. We're going to use chat and videos. I know it's really easy to kind of just turn a webinar on and listen to it and kind of answer emails and do other tasks because we're all super busy. But I'm hoping you can take a break from that for about 40 minutes or so to really learn some new strategies related to motivational interviewing or some old strategies that you might want to try again, and really try it on, because in order to use motivational interviewing or feel comfortable with it, you want to practice it and try and see, what feels comfortable to you. So in our short time today, I'm hoping we have a chance to, I'm going to share some information and you're going to be able to try that on and see how that might work for you in practice. So just to give you a little bit of a background, why motivational interviewing for adolescents? So why are we hearing so much about it? It's really because motivational interviewing has been studied extensively and shows promise as an effective intervention with adolescents in a variety of settings. So school-based health centers are a great place, and also programs, after school programs and programs with teens, as well as in primary care. So there's lots of different settings that you might be talking with teens about their behaviors that you want to have some kind of tools in your toolkit to help you and help them think differently about the choices that they're making to be safer. That's really our goal. And when we're looking at motivational interviewing and the research that's been done, it's been shown to be effective in a variety of risk behaviors, including a lot of the things that we're talking with teens about: substance use, sexual activity, healthy eating and exercising, feeling anxious, and then that kind of unintentional injury piece. So we know that with motivational interviewing and with kind of talking with teens about their behaviors, that telling them what to do is going to make them more resistant. So if that wasn't the case, our jobs would be a whole lot easier, because we could share with them the knowledge that we have and then they could act on that. But the more that we tell a teen what to do, the more resistant they become, because they're told what to do by everyone in their lives. If you think about it, their parents, their coaches, their teachers, if they work, their bosses. So they really want, and developmentally, they need to feel like they have control. So the more, even if a teen wants to do something and we tell them that they need to, they're going to feel less like they want to do it, unfortunately. So the way that we talk with them is super important in order to help lower that resistance. We also know that information alone is not enough to change behaviors. If it was, we would have a lot easier time in just sharing information and then having all of our patients and people act on it. And motivational interviewing really allows the teen to drive the process. So they tell you versus you telling them. And what we're going to go through in the webinar today will give you some ideas of how that works. So being effective in using motivational interviewing has a lot to do with our verbal, like how we're talking with them, what our communication strategies are, but also our nonverbal, like how we look when we're talking with them. And, sometimes we just have bad days. So managing our emotions is really critical, related to talking with teens, feeling comfortable in the topics that we're bringing up. And if we're not comfortable, thinking about ways that we could improve our level of comfort. If we're not comfortable talking about sex, if we're not comfortable talking about weapons, potentially. If you think about a comprehensive risk assessment, there's lots of behaviors that you may be discussing. So knowing what you're comfortable with is really important. And then how are you looking when you're talking with teens? Are you looking like you have your arms crossed? Are you with a computer in front of you? Or are you really engaging with them in a nonverbal way? So that can really affect what they share and how they feel about the interaction. And then the second piece is how we ask the question. So how do we phrase questions? Do we put teens on the defensive? Like, do we ask them why? Or do we prompt them for an answer, like the example you see here, like, you use condoms, right? So that we can kind of move along in, some of the information that we need to gather, because we do have a limited amount of time. So we want to get accurate information and also provide information in a way that's going to be effective. And that leads to how we talk about behaviors. So if we say, just say no, that's not an effective approach. So we're going to talk through some different approaches today. So where do I start? If we think about motivational interviewing, it's really based on building relationships. So there's a whole spirit and relationship building that's really important. And it doesn't have to take a lot of time. It can take a very short amount of time, but it's very intentional. So thinking about how am I building this environment, this relationship with the teens that are coming in to see me, whether that's for physical, mental health, health education, maybe some type of coaching. So we want to use specific strategies that help elicit information from teens and guides them towards making safer decisions. And what we're going to talk about today in motivational interviewing are some of those foundational strategies: the spirit, giving information, and the strategies of OR, open-ended questions, affirmations, and reflections. So the spirit really consists of a couple of strategies, the first being empathy. So showing empathy can go a long way in building a relationship right away. So if you have a teen come in to see you, whether that's part of a program or in a clinic setting, you may notice their nonverbals, that they don't look like they're having a great day. So you may start by saying something like, "You're having a hard time at school today." That helps them feel like, oh, okay, now I can kind of let that go, or share some information about that, and we don't have to like jump right into the reason that they're seeing you. So it just gives them a chance to feel understood before you start talking with them. You may start a discussion about a behavior or a way that you would like them to be safer by an empathetic statement. So if you look at the second one there, you might say something like, if you're going to talk to a teen about drinking alcohol, it's hard to say no when your friends are drinking. And an empathetic statement is not in agreement. So a lot of times professionals get a little bit stuck on that because empathy sounds like you're saying it's okay, but you're not. What you're saying is that you understand what they're going through, because it is hard to say no when your friends are doing something that you don't want to do. That's very difficult. So when you say that out loud, you're acknowledging that, and then you would follow that up with maybe a question, an open-ended question like, what are some of the ways you let your friends know that you don't drink or that you don't want to? Or if you know their intentions, that they don't want to drink, you might make a reflection like, staying committed to not drinking is really important to you. So you don't just leave an empathetic statement potentially on its own. If the teen starts talking and you start a conversation around the behavior change, that's great. But you want that empathetic statement to help them feel like they're understood so that you can continue the conversation and help them think through what they need to do in order to be safer if we're talking about drinking, or to be able to say no. The next strategy in spirit is asking permission. So when you have a two-way discussion with and not a one-way discussion at, so we're talking with our patients, we're not talking at them, you're building a relationship where they feel valued and respected. So a lot of times you might start by asking permission, especially if the teen hasn't asked us to provide the information to them that we want to give. So maybe they came in as a physical health provider. You have a lot of teens coming in for a physical health complaint or an immunization or a physical exam. They didn't necessarily come in to talk about their risky behaviors. So you might start out by asking permission. You know, you took the time to fill out this risk assessment. I'd like to talk with you for a few minutes about that. You might follow it up with to say, is that okay? Or if you want to talk with them about being safer when they're having sex or using condoms, you might say, I'd like to talk with you about using condoms, and then have them say, okay. They're not going to be 100% like, yes, I can't wait for this conversation. But if you look at the literature, the more that teens are offered that opportunity, respected, in saying, I'd like to talk with you about, and they just kind of shake their head or say, I guess, they're listening to you more, they're taking more in, they're participating in the discussion. So very simple things that you might start to use if you haven't tried it already can be really helpful. What you don't want to do is not use ask permission because you're worried that they're going to say no. Very rarely do teens say no. Obviously, they can do that. But if they do, it's an opportunity for you to find out more. So you might say something like, I'd like to talk with you about condoms. They're like, no, I'm not really into that. You might say a follow-up question like, well, tell me what you know about them, or tell me about your experiences. A lot of times they just don't want to be lectured to, but they are interested in having a conversation and learning more. It's just the approach that you have. You may also, if you see the second example, say something like, can I share some other information with you, some other ideas for ways that you can use condoms if we're using that same behavior example. So it really helps you understand what they know, directs what you might share, because there's a lot of information that you could share with them. And when you ask if you can share it, they're more open to hearing what you have to say. So the next strategy is giving information. So we just talked about spirit, and the next is giving information. But before we talk through giving information, what we do every day in our roles, because we're educating about whatever it is that teens are coming in for, not necessarily about the risky behavior every time. I would like to summarize kind of the underlying spirit of MI by showing you just a short video, and then we'll jump into giving information.
In communicating with young people, I think the single most important thing to do is listen, is to really hear what they say, both in terms of what they're unhappy with, but also in terms of their attempts to solve problems for themselves. And so I think that we need to go at this less as the experts who can tell them the way things should be done, but to hear where they are and to work together with them towards solutions. One good example of this is a young man who came into my exam room and flopped himself down and said, I'm sick of the world. What's going on? And he says, well, everyone is shoulding on me. And I said, what do you mean? He said, well, I'm being told by my parents I should do this, and I'm being told by my teachers I should not do that. And I don't want to be told what I should and shouldn't do. I want to figure out how to do it. And so we went into a conversation about this, and it became clear that he was doing what he should be doing as an adolescent, which is figuring out the world for himself, figuring out who he was and how he should behave in it and how he should interact with people. But people were telling him how to do it. They were saying, walk this way or do that way. And instead, he wanted to make it his own. And he was doing exactly as he should be at this developmental task. And yet what was happening was that people were telling him how to do things, and he was constantly in a position of having to decide whether he should do it their way or he should find his own way. One of the things that is really helpful is to remember that kids hear about 1% of what we say and 100% of what we do. So we need to listen well to them. We need to hear their solutions. We can redirect or make suggestions or help them to synthesize and understand where they stumble, but not tell them what they should do, but tell them what they can do, and let them figure it out for themselves, because ultimately they will, whether it's in communication with us or not.
Great. So that was just a really great example of how teens feel and some suggestions on how we might respond to them, not with what they should do, but what they could do. And that's going to be part of this giving information piece. So giving information is one of my favorite strategies to review and practice during the in-person workshops. So typically we would do some online and some in-person work related to motivational interviewing strategies and feeling comfortable and learning them and practicing them. So this is one of my favorite things to do because it's what we were trained to do. We've learned a ton of information. We have a lot of information that could help our teens in their health, their well-being, their success. So how do we get them to hear us more? And with giving information, there's 3 strategies that I'm going to share with you today that can help teens and you when you're talking to talk with when giving information, and for them to hear and potentially act on the information that you're giving. So the first one is to give information simply, and information that's factual, not opinion, obviously. And remember that adolescent brains are still developing. So providing information that speaks to that teen situation or behavior kind of in the here and now and not in the future would be really important. So an example related to this that I used a lot in STI testing or talking about sexual health is that I found to increase a teen's perception of risk. So we know perception of risk relates to decisions and behaviors. I would ask them if they wanted to know what the chlamydia rates were in their zip code. So when you look at the local health department, your local health department should have the chlamydia rates posted, or you should be able to access them somewhere. So it really brings it down to kind of the here and now. So last year in 15 to 19-year-olds, this is how many had chlamydia in the zip code that you live in. And teens have never said to me, no, they didn't want to hear that. They were interested in hearing about, teens that live in their area and the rates of chlamydia and gonorrhea. And it did help increase their perception of risk, increase testing when some teens were kind of like, I don't really need to be tested, not having any symptoms, that sort of thing. So figuring out how you can give information simply that would relate or that teens might be able to connect with is really important. The other piece of giving information simply is figuring out how to really direct your message down to about 30 seconds at a time. So if you feel like in your interactions with teens, your visits, your sessions, that you're doing most of the talking, try some strategies that we're going to go through today to have the teen do more of the talking. And if you're giving information or you're sharing things with teens, try to do it in much smaller pieces so that they can respond to it, and then you can give them some more information from there. The next piece is offering concern, and professionals should offer concern if we are very concerned about a teen's behaviors, that they may cause harm, immediate harm potentially. And teens do appreciate it when adults care about them. It feels good to have somebody that's concerned. We just have to be careful not to push them too much when we are concerned about them. And obviously there's different levels. There may be times when you need to make referrals or bring other people in, and that's a separate situation. But you may offer concern by making statements like, I'm really concerned about your health, or I'm really concerned about your safety. And I hope that you'll consider some of the things that we talked about today in next time that you might be in that situation. Or I hope you'll consider kind of making a change or making some changes in what you're doing. Or if it's someone you know, I'm really worried about you, you're stressed out, you're smoking a lot more, this could really get in the way of everything that you've been working for. So you can offer concern in ways that help teens think about the actions that they have and what their goals are, what their motivations are for wanting to be safer, wanting to change a behavior. And then offering a menu of options. So there's more than one correct way to solve a problem, obviously. As professionals, we know that there are lots of options for deciding to be safer or not engage in a behavior or to engage in something safer. So just remember, when you're at that point where teens are like, oh yeah, I really want to make a change, we get really excited because that's what we're hoping for. So we kind of jump in and provide a solution to them instead of asking what they've tried or what they're considering or what they think they could do. And then ask if you can share some other ideas with them so that they're more open to hearing it instead of jumping right in. And you might brainstorm some other options. The key to that then is to let the teen choose what they think would be best for them. Because the more they say things out loud, the more that they're likely to actually act on those things versus us saying it out loud. So we talked through spirit and giving information. There's a few things out of there, hopefully, that you kind of wrote down or you thought you might try on or use and see how that works. And now we're going to kind of touch on 3 of the foundational strategies of motivational interviewing: the O, the A, and the R. So the O is for open-ended questions, nothing that you didn't learn in elementary school, that who, what, when, where, how, and the why you just have to be more careful with. The key to using them as part of motivational interviewing, though, is that you're deliberate and that you're directive in how you're framing questions. So you're not just asking questions to gather information or history, which some of that we might need to do related to our work. But what we're trying to do is really ask a question that leads teens towards talking about their behavior, about, what are the good things, what are the things that aren't so good, ultimately hearing in motivational interviewing change talk around a behavior. So I want to give you a little bit of taste of it, and what we're going to do is use that kind of questions or chat box. So you should have open your like GoToWebinar panel, and you can see the questions chat area. What you want to do is type in your response and then click send. So I'm going to give you 2 questions, and I want you to type to me or type to the group, because everyone should be able to see it, what your responses would be to this question. So thinking about that, who, what, when, where, how, and why. How would you answer this question? Like, type it into the box. How was your day? So if we were sitting together and I said, how was your day? How would you respond to that? So we're getting okay, fine, good. My day's been very busy. I'm sure we can all relate to that. Good, thanks. It's fine. Lousy. So it's good. We're getting honest. Sleepy. So we usually, with that who, what, when, where, how, we usually get 1 or 2 word answers. If you notice, which we're going to talk about in the previous slide, those words were across the top, and then there were 2 sections: fully open questions and key questions. So taking out of the fully open questions a question starter, the same question, but now I'm asking you, tell me about your day. If we were sitting together and I said, tell me about your day, what would you respond? How might you respond to that? Tell me about your day. So now I have a lot longer responses. It's very, very busy, but I'm trying to catch up. I've had a rough start. It's not going as I planned. I feel hopeful that I'm going to get a lot done today. I slept in this morning and checked off a few goals and listened to a fantastic webinar. So those are great. So do you notice the difference? This is the one strategy that can really make a significant impact in what you learn from teens. So how was your day versus tell me about your day. When I do work with parents, this is the one strategy that I suggest they start with, because their teen talks so much more to them when they use the tell me about your day when they come in after school, because all of us do that if we have kids or even partners or anyone else we're around, like, oh, how was your day? Versus, oh, tell me about your day. They get a lot more response and they feel like, oh, this is interesting. I want to learn some more about the strategies and try some other ones on. So this is a really great strategy to start with, or if you're working with parents. So to come back to those open-ended questions, the fully open questions and then the key questions, kind of what I mentioned in the previous slide. So looking at fully open questions, they provide us with more than that yes or no response. These question starters you might use, like, what do you think about? And then you could put whatever behavior after that. So like, what do you think about texting and driving? The tell me about, you can put with anything. You could even have it more generic, like, tell me about your experiences with this. How do you decide when to? A lot of times I use this, I'd say, how do you decide when to use a condom and when not to? Because so many times kids will say, oh, I use a condom sometimes. Well, how do you decide when you're going to use it and when you're not going to? Because that helps me then know when I'm giving information what they need. Is it that they didn't have access to condoms? Is it that their partner isn't interested in using condoms? There's whatever that is. Now I know how to direct my education. And then help me understand can be helpful in if you want to use why, or you're somebody that uses why a lot. So, why are you down here again after being in trouble? Or why did you get in that fight? Help me understand why you are a part of that interaction again, or that fight. When you put help me understand before, when why is the first word, that puts people on the defensive. So if you use that starter, that can help if you're someone that's comfortable with why. And then key questions are really those questions that's going to take that teen into thinking about next steps. So you may not always get to key questions when you're working with youth around, talking about a behavior or even taking medications as prescribed or as they need to. There's lots of different ways. We're talking about behaviors today, but you can use motivational interviewing for a lot of the different work that you're doing. So some of these key questions you may ask at the end of your session, maybe in the middle. Things like, given what you told me, what do you think you're going to do next? Where would you like to go from here? What if you tried talking to your partner about condoms? Or what would it take? So you're not interested right now in cutting down on your marijuana use. What would it take for you to change your mind or think differently about that? How, if at all, would that work for you? And then what do you see as your options? Those are all things that you can use, questions you can use, very deliberate. You're trying to direct how teens are responding, what they're thinking about in order for them to make decisions that might be safer for them. So let's practice this. Again, if you go to the question chat box, you can click that open and respond here. So I'm going to put up a closed-ended question, and then how would you ask it open-ended instead? So I know a lot of times we need to ask, do you drink alcohol? So if I'm asking that in person, how might I ask that as an open-ended question instead of the closed-ended? So think about that, kind of type in your response. So we have some, what is your experience with alcohol? Tell me about your alcohol use. What kinds of beverages do you drink? How much alcohol do you drink at one time? So we're getting into a little more of the details. What is your experiences with alcohol? How do you feel about alcohol use? Those are great. You might also, depending on what the reason is that you're talking with them, maybe you know them, you might get into more of planning, like how would you handle someone offering you an alcoholic drink at a party? So it all just depends on where you're going with it. So these are great responses. Let's try another one. So same thing. Are you interested in learning more about ways to eat healthier? Sometimes we ask that, and we might ask that if we're asking permission. So what would be a more open-ended question for that? Instead of, are you interested in learning more about ways to eat healthier? What specifically would you like to know about eating healthier? That's great, because then you're really getting from them what they feel like they need. What does eating healthy mean to you? What does that look like? How can you have a healthier lifestyle? What are your favorite foods? Yep, so now you're kind of getting into the details, like what would it be that they might then be a step to eating healthier? What do they like? What does eating healthy mean to you? That's important because sometimes we use words that they may not relate to, or they might think about them differently. What do you enjoy eating? That puts a very positive frame on it. Great. So these are really, really great examples, and just kind of a way to think about, so in the back of your mind, kind of pay attention to how much you're asking closed-ended versus open-ended questions, and can you kind of change those around. So affirmations really are pulling out strengths of teens. Teens who are told or feel that they're not good enough are more likely to use substances, report depression and anxiety, and have sex at an earlier age. So it's really important that we think about affirmations and finding the strengths in teens so that they can feel they have the self-esteem and self-efficacy to make healthy decisions for themselves. It keeps a focus on the positive views of teens, because teens will live up or down to our expectations. So if we are trying to find strengths in them and then affirming or stating those strengths, then teens will kind of live up to those strengths. It can empower them to take control of their decisions, plan for risky behaviors, and having that high self-esteem really is a protective factor in engaging in unsafe behaviors. So affirmations are you statements. They're not I statements, so that can feel really weird because we were taught never to assume or say you are or you have. Just like you see here, you feel, you believe. That can feel a little bit uncomfortable. So think about, I'm going to give you an example. You statements can be very, very powerful, and to help teens kind of feel like they can make positive changes for themselves. So if you and I were talking about your work and I said to you, I think you're great at your job. Or instead I said, you are great at your job. How does that feel different? Kind of just think about that for yourself. I said, I think that you're great at your job versus you're great at your job. There's a much more powerful feeling to the you versus the I, because if I say I think, then it's up to me. Like, you need to be around me all the time in order to feel like you're good, potentially. And if I say you are, that takes me out of it and I don't need to be there. It just is a statement of fact, like you are good at your job. So kind of think through how you might use affirmation statements, or what would make you feel comfortable starting to use them if you statements doesn't feel like something that you would be able to readily do. So some of the examples you have, you are, you feel, you believe. So with teens, you might say something like, you've kept your promises related to your phone use. So if they were really working with their families, struggling with phone kind of restrictions and things like that, you've really kept your promises related to phone use. Or you are mature enough to handle adult discussions like sex, or you're mature enough to be able to make this decision for yourself. You feel in control of your body. That can be really powerful. So if it's someone that is starting a new birth control method, you might try to affirm them by saying something like, you feel in control of your body now. With the you believe, you might say something like, you believe in respecting your partner. That can really affirm them and empower them to continue doing that. So we're going to practice this a little bit as well. I know I'm kind of giving you strategies and then a little bit of an opportunity to practice without going into it too much, but hopefully it gives you at least an idea and you can try it on a little bit. So I'm going to put a statement up for a teen, if a teen made this statement to you, and then in the chat box again, if you can respond with using you have, you are, you feel, or you believe, that would be great. So if you have a teen that says, I'm doing everything I can to graduate, and they're kind of frustrated and needing kind of that support or that affirmation, how might you use these starters to affirm them? So we have some like, you're working really hard, and that's perfectly fine. You're working hard in your schoolwork, you're working hard to graduate on time, you believe in your education and your will to get there. You're working extremely hard despite having a lot of hardships this year. You're showing how ambitious you are. You believe it's important to graduate. You're doing your best to graduate. You're dedicated. You have a goal and a drive to get there. Those statements feel good. Those statements are very empowering. So what we normally do, though, if we hear a statement like, I'm doing everything I can to graduate, typically we would ask a question. So what are the things that you're doing to graduate? And let me give you some other ideas and where you're struggling. And you should get there, you would get there, but try giving an affirmation first. Like, you're showing your commitment to graduate, you're goal-oriented and will get there. Starting with that really empowers the teen to have the discussion then of where they're struggling and what they might need to do. One more for affirmations. I've tried using condoms and it never works out. How might we affirm that statement versus go right into trying to solve the problem, which we will get there. We want to solve the problem, but how might we provide an affirmation first? You're trying, you're being mindful, you're being responsible in trying to work this out. You want to keep yourself safe from STIs. You've been responsible with your sexual health. You're thinking about safety. You feel frustrated. That's perfectly fine to point that out. You feel frustrated is more of a reflection of feeling. Great reflection and could lead to discussion around that. Affirmations are really reflections of strengths. So it's sometimes confusing. Let's see. You're trying to protect yourself and your partner. You believe in protecting yourself and are having some difficulty. Those are all great. So this was an example of kind of thinking about, instead of just jumping right into problem solving, to give teens some affirmations on what they are working on and what they've been able to do prior to kind of coming to you for some more help. So great examples. Thank you for sharing. And then the last strategy is reflective listening. So reflecting is one of the primary skills used in motivational interviewing, and it's one of the most difficult to master. So I'm just going to kind of explain and give you some examples of reflections. They can be difficult. It's how we might express interest, empathy, understanding, showing teens that we're listening to them. Teens often perceive themselves as not being listened to, so when you use reflections, it can be really powerful. You'll see their body language change as soon as you start reflecting, and they're like really engaged and lean in to talk with you then at that point. It's stating back to teens what you heard. It might be adding an emphasis, an additional meaning, or a continuation of their thought. So again, you're making some assumptions when you're reflecting because you're trying to lead teens towards thinking about their situation differently. Key guidelines for reflections: use 2 to 3 for every question, and be okay with silence. So that can be difficult for us as providers because we have a certain time with teens. We want to fit as much in as possible and everything that we need to. So if you reflect, if you're using reflections, give teens a few seconds to respond before you jump in and ask a question, or you think, oh, this didn't really work well. Give them a chance, because how often are teens asked about their opinion on things or what they think? And the next step of just giving them a statement about what they said and letting them have a chance to think through it before they respond to you. Their brain development, they need a little more time to process kind of what you said and how they feel about it. So a few examples, very simple reflections. There's lots of different reflections that you can use, and simple and more advanced reflections. So if a teen presents for STI screening, is having sex and not using protection, you may repeat, which is the simplest form of reflecting, back kind of the actual words that the teen said. So you might say something like, you're having sex and not using protection. And you need to make sure that it's a statement, that you don't inflect at the end, like, you're having sex and not using protection. That probably wouldn't be a great question to ask, because it sounds like a question when you make that inflection at the end. So you want to make sure when you're trying out reflections that your tone of voice is neutral and that you make them a statement. And it might sound like, oh, why would I say that? They just said that to me. Why would I repeat that back to them? And it helps to build that relationship. They'll continue typically the conversation, or if they just say, then they know that you were listening to them and that you didn't just jump right in to be like, oh, why aren't you using protection? You know, A, B, and C could happen. So you will get there, but you want to get there in a different way. Rephrasing is staying close, or you're reflecting back in your own words the meaning of what you heard them say. So you're trying to stay close to what they said with some rephrasing. So you might say something like what you see here. You're not using protection and you don't want to get an STI. It's pretty safe to say that most teens don't want to get an STI. So that's kind of what you're moving forward, or what you're assuming. Paraphrase, you're guessing at the meaning of what they said, and then you're reflecting that back. So you might say, you'd like to be safer when having sex. You're guessing that that's what they want. So if they say yes and start talking to you about, what they think being safer is, what they need, kind of they're directing the conversation. They're talking, they're saying it, so they're more likely to hear what you have to say in response and to act on it. And then reflecting feeling, I pulled that out of one of the affirmations, is emphasizing that emotional dimension. Like, it's scary to think about getting an STI. Most kids do feel anxious or scared or angry, or there's a lot of feelings that they could have if they think about getting an STI. So with reflections, because it's a little bit more difficult, I just want to give you a couple of examples. We're going to do a poll. So if you have a teen statement of the teen sitting in front of you and they say, seriously, I don't want to be lectured about drugs. How might you reflect that to help them think through or share with you some more information about using drugs? So remember, we're talking about reflections. So what you see here, A, B, C, or D, this is too important not to talk about. Is A, I'm not lecturing you, I'm making sure you have correct information. What do you know about drugs? Or you know what you need to keep from using drugs. What would be an example of a reflection? Take kind of your best guess. So we're going to open the poll. And remember, we're trying to reflect. So reflections are statements. So for this, we're practicing reflection. So I'll give you another couple seconds. We have almost 3/4 of everyone having kind of entered their response. Okay, so we have about a split of 45 and 42%, if you can show the poll results, yep, of what do you know about drugs? And that is a great question to ask. What do you know about drugs? Because then you can hear from them what they think. But what we want to know is kind of what reflection might lead them towards change talk or talking about being safer. And that would be D. So you know what you need to keep from using drugs. They'd be like, yeah, this is what I should do, A, B, and C. Or, well, I'm not sure I know what I need to do. And then you could share some information with them. So this is just an example of practicing reflections. We're going to move to another statement. If you're talking with teens about, you know, social media and how things get blown up in, you know, Facebook and Instagram and Snapchat, you might be talking about boundaries. So the teen might say to you, I have boundaries when it comes to sharing on social media. So to reflect, if you heard that from a teen, to reflect that, what might you say? A, B, C, or D? And obviously there's other ways to reflect as well. So you're frustrated by not having time. Oh, I'm sorry, I looked at the wrong one. You know what you're okay with and what you aren't is A. B, what are your boundaries? C, you don't like just anyone knowing about your business. And D, everyone has some type of boundaries. So we're working on reflections. So reflections are statements, and reflections kind of lead teens towards thinking deeper about what they just said. So what do we think related to reflections for that? Give you another couple seconds. Okay, so if you can show the responses. So A is the answer of the reflection that would be best in this situation, to say, you know what you're okay with and what you aren't. Teens will share with you then what that is. If they don't and they say, yeah, well, tell me more about that. So you can follow up with a question if you're using reflections and teens aren't responding to that. What are your boundaries? Great follow-up question that you might ask. You might empathize, like you don't like just anyone knowing about your business. That's a good empathy statement. And everyone has some type of boundaries is also kind of a statement that says, yep, everybody's worried about this, everybody's doing this. But looking at all those, A would be the reflection that you would want to use in order to move them forward with talking to you about what their boundaries are. And then this last piece, I'll just read through them. We won't do the poll just for the sake of time. So if a teen says, I could start exercising, but I don't have time. A lot of times when we hear that, we start trying to solve the problem of time. So if you look at the options here, you're frustrated by not having time to exercise. I have some ideas that might help you. It's hard to find time to exercise. Or you want to start exercising. So this one is a little bit tricky, and we spend a lot of time on the in-person related to but statements. So having the word but in there. When that happens, we kind of disregard the first piece, but the first piece says, I could start exercising. So that's what you want to reflect. You want to start exercising. They said they could at the beginning of that statement. So you want to try to pull that out and see if they'll continue talking about that. So just some key takeaways from this short amount of time that we had. Think about the spirit of motivational interviewing, kind of empathizing, asking permission, building that relationship, even with just one strategy, one or two statements can build a relationship right away. Giving information, how are you giving information? Is it very short? Does it really give someone an idea of increasing their perception of risk or something that would help them think differently? And then the open-ended questions, affirmations, and reflections. Hopefully you took something away that you can try today and see how it goes. See, how your teens respond to that. Practice is really the only way that you get better with using motivational interviewing strategies. You can use them at home, at work, with your patients or clients. It's really a great way to communicate. So it's not specifically, you're not doing anything to someone. You're just trying to listen more and elicit responses from them. So try it on, get comfortable, then add more strategies. The other thing you can do is attend a motivational interviewing workshop. And at the School-Based Health Alliance conference, there's a pre-conference session that I will be doing with another trainer on June 23rd. So if you've registered for the conference yet or not, as Tiara said, you're in kind of the early registration time of it being less expensive. So if you go to this link, and I believe we put that link also in the webinar panel that you could click on, go to the schoolbasedhealthforall.org, SBH for all, and to the convention and registration to register for that pre-conference session. And it is funded session, so I believe it's either free or low cost, and it's limited in numbers because we like to spend some time working with you in small groups, big groups, individually, to make sure that we're answering all your questions and that you have the opportunity to practice. Just a little bit about the training itself. As you're considering, the conference and pre-conference sessions, you got a little bit of a taste of MI strategies during the webinar, and the workshop consists of an online component and the in-person piece in that pre-conference session. So there's 8 CE, CME credits available in completing that online component. The online or the in-person workshop kind of translates that knowledge into practice. So we do a lot of different activities related to trying on, multiple strategies. It really helps equip professionals to use the strategies. We are the only organization that specializes in that real-world application of motivational interviewing for youth and their risk behavior. So we spend a lot of time talking about youth brain development and development in general and how that impacts how you might use some of the motivational interviewing strategies. The workshops itself has been proven effective, and we have a journal article published related to increasing skills, capacity, and comfort level in using motivational interviewing strategies following the workshop. We also evaluated the workshops we've completed over the last 2-year time period that have a statistically significant increase among the participants in the confidence and skills necessary to apply motivational interviewing within your work with youth. So some of the outcomes here, you can see what participants are saying about the workshop. Also, we have in the handout section some of this information if you're interested. So we definitely wanted to give you that. Know that we're going to be doing that pre-conference session and to register for that early if you're interested, so that you have the opportunity to kind of try these things out with some trainers and the opportunity to kind of learn more from the rest of the group that's participating as well.
Thank you for walking us, for participating in the webinar. We hope that you were able to take away some strategies that will enhance the work that you're doing with youth and young adults. At this time, please be sure to download any handouts that you would like to have access to, and we will be following up with a recording of the webinar. If you would like to have more information on scheduling a training, or if you have any questions, please feel free to reach out to us. The contact information is on the slide right here. Great. Thank you, Dr. Salerno, and we look forward to answering any questions that may come up. Everyone have a great day.
Great. And I'm kind of looking at questions, so I don't see any right now, but definitely reach out and we can answer them over email. So great. Thank you.
Thanks.